Malaysia, Thailand, and Vietnam are leaving their zero-COVID policies behind, but they aren't ready to open up. Experts warn COVID-19 swept across the region this summer, fueled by the highly infectious Delta variant, with cases climbing steeply in July and peaking in most countries by August.Yanzhong Huang, senior fellow for global health at the US-based Council on Foreign Relations think tank, said if vaccination rates aren't high enough with high-efficacy vaccines before restrictions are lifted, healthcare systems in Southeast Asia could quickly become overwhelmed.
You're going to see the spike of severe cases, then it's going to overwhelm the ICU, beds, ventilators. There's going to be a shortage capacity challenge, he said. But for much of the public and many leaders across the region, there seem to be few other options. Vaccines are in short supply, and for many Southeast Asian countries, mass vaccination is unlikely to be achieved in the coming months. All the while, as people lose work opportunities and are confined to their homes, families are going hungry.
Jean Garrido, a diving school operator in Thailand's Phuket Island, said small and medium-sized businesses are desperate for borders to reopen. He wasn't sure how much longer the country's tourism sector could survive. He added. End of zero COVID from June through August. Many Southeast Asian countries introduced strict restrictions in an attempt to control the COVID wave. Malaysia and Indonesia imposed lockdowns nationwide, while Thailand and Vietnam put in place lockdowns in high-risk regions. Under these restrictions, millions of people were told to stay at home whenever possible and prohibited from domestic travel. Schools closed, public transportation was suspended, and gatherings were banned. Indonesia, which has inoculated more than 16% of its population, has also eased its restrictions, allowing public spaces to reopen and permitting factories to return to full capacity. Foreign tourists might be allowed into certain parts of the country, including the resort island Bali, by October, according to Reuters. In some ways, the region's rapid reopening reflects the living with COVID approach in Western countries like the United Kingdom and parts of the United States, where daily life has essentially resumed as normal. Among Southeast Asian countries, Singapore has openly come out in shifting away from the previous zero-COVID policy, said Abhishek Rimal, Regional Emergency Health Coordinator at the International Federation of Red Cross. And though others have not made any such formal announcements, their swift reopening suggests governments are weighing the long-term sustainability of the strategy. Dangers of reopening too soon. Experts warn, however, that low vaccination rates in parts of Southeast Asia, including the Philippines, Indonesia, and Thailand, will make reopening much riskier than in the West. And though they are still seeing cases, with several reporting brief spikes after reopening, the number of COVID deaths and hospitalizations has stayed low in these Western countries, indicating the benefits of the vaccine. Waiting for global demand to ease and for supply to open up isn't really an option, either. People's lives and livelihoods have been severely disrupted for almost 2 years now, with potentially dire consequences if they're not allowed to resume. Millions of people are struggling to meet their daily needs, said Rimal. There is a huge workforce in Asia that depends on daily wages, and they are being affected because of this economic downturn. As the pandemic drags on, with communities lifting and reimposing lockdown every few months as families go hungry, people are also experiencing pandemic fatigue. Economic strain aside, governments also face building public pressure to reopen. It's the major dilemma facing scientists, policymakers, and world leaders in Asia, Rimal added. We know vaccines are a major answer. We don't have access to the vaccine, while we see people suffering and facing job loss. That's why humanitarian organizations like the Red Cross are calling on global leaders to provide more vaccine doses to low-income and hard-hit countries in South and Southeast Asia, he said. But in the meantime, if countries are set on reopening anyway, there's only one thing they can do: strengthen all other aspects of their pandemic response, such as public health measures, testing, and contact tracing. Unless we do this, we will definitely see a surge in cases in the days or weeks to come, he said. Vaccine blues. There is another major consideration that could make the region's transition to living with COVID more difficult: the types of vaccines on offer. Many countries in Southeast Asia have heavily relied on Chinese-made vaccines, which generally have a lower efficacy than those made by Western companies. According to Duke University, Thailand has bought more than 40 million doses of the Sinovac drug, while the Philippines and Malaysia have around 20 million each. Cambodia has bought another 16 million. Meanwhile, Indonesia has bought 15 million doses of the Sinopharm vaccine, while Malaysia has got another 5 million. While experts generally agree that having access to any vaccine is better than none, the Chinese-made drugs have a lower level of efficacy than Western alternatives such as Pfizer's or Moderna's vaccines. Brazilian trials have shown that Sinovac has about a 50% efficacy against symptomatic COVID-19, and 100% effectiveness against severe disease, according to trial data submitted to WHO. Sinopharm has an efficacy of about 79% for symptomatic and hospitalized disease, according to WHO. In comparison, Pfizer and Moderna vaccines were more than 90% effective. China's Foreign Ministry spokesperson Wang Wenbin previously dismissed criticism of the country's vaccine's efficacy as a bias-motivated smear. Huang, from the Council on Foreign Relations, said attempting to reopen while fewer than half the population is vaccinated, while using less effective vaccines, could cause a flood of cases to overwhelm hospitals and even lead to a reintroduction of restrictions. Other countries have begun to move away from using the Sinovac vaccine among concerns over its effectiveness. In July, Malaysia said it would stop using the Chinese-made shots once its current supply of 12 million doses ran out. Thailand said in the same month it would revaccinate its health workers with the Pfizer drug once doses arrived, despite already fully vaccinating them with Sinovac. I think if they manage to use the highly effective vaccines as booster shots and let a significant percentage of the population be vaccinated, then certainly it's going to make reopening more justifiable, said Huang.
Thank you for watching. Please subscribe